What's up, y'all? It's Celeste, and it's now been 3 weeks since I had my double incision top surgery with Dr. Garramone, and it feels really weird that it's only been 3 weeks. It feels like a lot longer than that, and it really feels like I've been home a lot longer than 2 weeks, but anyway, I have, so here's my update. I'll show you my chest in just a second, but first I just want to give a little bit of an update on the bandages that I've been using, because if you watched my last update, you saw that the Telfa pads that I was using, the adhesive really irritated my skin and it made it turn all red and it was very itchy and uncomfortable. So I switched to using just plain gauze and medical tape. And I was originally going to be getting paper tape to use because that's supposed to be one of the best things for sensitive skin. But I ended up getting some cloth tape because when I was looking on Amazon for paper tape, this particular cloth tape, which is 3M Metaport H tape, had really good reviews for people talking about that it was really good for sensitive skin, fragile skin, and everything like that. So I thought that it would be good. And it is pretty good. I still do have a little bit of itching underneath it, but I think that's probably going to happen regardless of what I use. The main thing that I'm not crazy about with this is that it's 2 inches wide and there are perforations every 2 inches. So every time you tear off at a perforation, it's a 2-inch square. And that's really like twice as wide as I need it to be the way that I do the gauze. So I'm kind of wasting some of it, which is kind of annoying. And the adhesive on it is too gummy to really be able to cut it. I tried that. So that's the only kind of downside to this, but I will put a link in the description if you want to try it out. And the other thing that I got is this Safe and Simple No Sting Skin Barrier Film, which comes in these little packets here, and you open it up and it's just basically kind of like a baby wipe. But what it does is it creates a barrier between the adhesive and your skin. So you basically just wipe it wherever you're going to be putting adhesive and let it dry, and then you put the adhesive over it. I've used this sometimes and then other times not. And I haven't noticed a huge difference with it, and I don't know if that's more a reflection on the fact that this tape isn't really that irritating to me, or the fact that this maybe doesn't work very well. I don't know. But on the Safe and Simple website, they actually have a thing where you can fill out a form and get free samples sent to you. And I did that at the same time that I ordered some, because I thought that, like, usually when you order free samples of something or like do anything like that, it takes them like 6 to 8 weeks to send you something. So I didn't want to wait that long, so I went ahead and ordered a package of them, but I still figured, like, why not get a few for free too? And the free samples came like 2 days later. So if you are interested in trying these out at all, I will put a link in the description also for the website where you can fill out to get free samples of them. And I should have checked before I did this video. I think they maybe sent me like either 2 or 3 of this size, which is the same size that I ordered. And then they also had some smaller ones that I think they maybe sent me like either 2 or 4, I think. I think they're like maybe in like 2 connected to each other. So I can't remember if there was like 1 or 2 of those, but anyway, it was a decent amount to try out. So if you are even like thinking about trying these out, then obviously get the free samples first, because they come really fast and you can just check them out before you have to buy anything. Today's the first day that I don't have the ace bandage on, which feels a little strange, not quite as weird as I thought it would, but when I first put my shirt on, it was just a little different. But I still have the nipple dressings for another week. My pain is still kind of fluctuating a little bit. I do still have some pain. I haven't actually taken any pain medication for the last couple of days. I'm just kind of trying not to. I originally was trying to just not take the Percocet anymore at night because I didn't want to like get dependent on it, not like addicted, but just like I didn't want to feel like I couldn't, like that was the only way I could sleep. So I took a half of one, and then I haven't taken any for the last 2 nights. And then I haven't taken any Tylenol or anything either during the day. So I guess I'm doing pretty well. I mean, I do still have some pain, but it's like, it's not so bad that I can't just mostly kind of ignore it. And it's not constant, like it does kind of come and go still. So you know, it's manageable. I also still have some itching, which I'm hoping is going to get better now that I don't have the ace bandage on, and maybe after I stop having to have the bandages, like the medical tape on. But some of the itching is just from the healing process. It's just like the actual incisions are itching, and you know, that's just part of healing and like scar creation and everything. So that's probably going to be there for a while. So I am still taking the Claritin in the morning and Benadryl at night, and I'll probably try not taking them maybe tomorrow or something, but I've been a little bit afraid up to this point because I just don't want to get really itchy and uncomfortable and everything, but I don't want to take them forever, so I'll probably try stopping that pretty soon, just see how I do. I do have more range of motion and ability to do more things, but I still need a lot of help. But I'm able to do more like cooking and stuff like that. I can't reach things in cabinets, and I can't lift heavy things like different kinds of pots and pans and stuff like that. I can't lift all of them, but I'm able to do more things like pretty much every day. I'm trying to do like more and more stuff. Again, trying not to push myself too hard, but like what I'm able to do, I am trying to do that stuff. And I'm able to do a lot more now than I was. Definitely a lot more than 2 weeks ago when I first came home. I could practically do nothing on my own, but now I'm able to do a lot more stuff, so I'm definitely seeing improvement there. Sleeping is still very uncomfortable for me. It's actually more uncomfortable now than it was at first, especially the first week, maybe because I couldn't move very much and because I was on so many medications and things like that. I basically would like sit in my position and I would pretty much stay in the same position all night. And now I'm still sleeping sitting up because I'm afraid that if I try to lie flat on my back, that I'll try to roll from side to side, because I am a person who moves around a lot in my sleep, and I typically do roll around a lot, and I can't do that. So I'm still sleeping sitting up, but I'll wake up and I'll have like slid down a long ways, and so then like it ends up hurting my back and my neck because I'm in some like awful position, things like that. So it's not really the most fun, but I still have 3 more weeks that I have to sleep on my back, so trying to make the best of it. But I have this whole setup of like different pillows and the neck pillow and then like a rolled up towel behind me to support my back and like all this stuff. And I mean, it's not the absolute worst. It's not like totally uncomfortable, but it's definitely not as comfortable as just sleeping normally. So I'll go ahead and show you my chest now. Again, this is going to show my incisions and my nipple grafts. So if you don't want to see that, look away now and I'll let you know when it's okay to look back. So here's how I look at 3 weeks post-op. And you can still see the irritation left over from those Telfa pads that I was using last week, and some dry peeling skin in different places where I had different kinds of bandages and stuff. My skin is like so sensitive, but other than that, I can't really tell without comparing side by side exactly how my incisions and the nipple grafts look different from how they did last week, but I think the nipple grafts are a little bit scabbier looking. I kind of expected them to be more scabby by this point because I'm only supposed to use the dressings for another week, so they're supposed to be pretty much healed by then, but I still have pretty much all of the sutures around the areola, and like, I don't know, I don't know that they're going to be entirely healed by then, but the incisions look pretty good. There's this one part, well actually kind of both sides, but especially on this side, it seems like it's maybe a little bit scabby right here, and also like almost not entirely healed right here, but I don't know why that part is taking a little bit longer to heal, but overall they're looking pretty good. Okay, it's safe to look back now. So I haven't done a whole lot yet as far as scar care. I got some rosehip oil and I'm going to be using that on the incisions, but I haven't started that yet because I want to make sure that the incisions heal completely before I start using anything like that. And especially in that middle part, I'm just not entirely sure if that's really healed all the way. I did get some Mepiform scar sheets that I'm cutting into strips to put over the incisions, and I had them on for most of last week, but I took them off yesterday and I haven't put new ones on yet, but I am going to. I kind of, like, again, I just want to make sure that everything's healed up before I start doing too much of that. So I'll probably have more of an update on that next week. As always, if you have any questions, you can leave them below or message me. And if you like this video, give it a thumbs up and subscribe to see more of my future content. Thanks so much for watching, and I'll see you guys next time.